Your community, your health.
At the KSMO studios, now time for our spotlight on the Salem Memorial District Hospital, being brought to you by Inman Insurance, as they are wanting you to remind yourself that when you contribute to your community, you make things happen. So be looking out to help your friends in your own community, and they're there for you with the insurance needs that you might have with a full line of insurance products. Remember, their Steve has deep roots right here in Salem, and with over 30 years combined insurance agency experience, serving everybody right here in the Salem and Denton County area. Call Inman Insurance, 729-4534. But remember, your part in the community can't be replaced by insurance. It's what you do to help your community grow. Well, we have Amy Thompson with us. Hey, Amy.
Hello.
All right, how you doing, girl?
Good. How
Oh, fantastic. Tell you what, we talking to Amy, and you were supposed to have Cindy Fry with you, but Cindy got stuck in a meeting, so
did.
you're solo today.
Busy lady today.
I'm telling you. It happens.
It happens.
It does happen. But we're in here and we're going to talk a little bit about colon cancer and what it is, how you get it, what you can do about it, and how to possibly avoid it. So
Correct.
let's talk a little bit about it, actually.
Okay.
So tell me, let's start with the very basics. What is it?
Well, March is Colorectal Cancer Awareness
Right.
Month, just so everybody is aware of that. But colorectal cancer is cancer that starts in the colon or the rectum. It
Okay.
can also be called colon cancer or
Right,
rectal
right.
cancer. Your colon is a big, long, muscular tube. It's about 5 feet long, divided into different sections, but it connects your small intestine to your rectum. And cancer is when cells in the body start to grow out of control. And this can happen in nearly any part of the body. They can become cancer and unfortunately spread to other parts of the body.
Known mostly as polyps, right?
Correct.
Yeah, mostly
Correct.
as polyps, and this can happen.
Mm-hmm.
Now, you hear about colon cancer in all different ages, but for the most part, this usually happens when you get 50 and above.
Correct.
However, there's a number of reasons why you could get this type of cancer. One, hereditary. Is it hereditary?
Yes, it can be hereditary.
Okay.
There's factors that you can help, and some, unfortunately, you can't help. Your age, unfortunately, like you said, over the age of 50, your chances increase.
So why would that be? Is that because your systems just change?
I believe so.
Yeah. I mean, obviously,
obviously, your diet over time, your smoking over time, exercise over time, all of that just over the years takes its toll, unfortunately.
Sometimes I often wonder, we have that metabolism that keeps us going and that drive and
Correct.
stuff, and all of a sudden you get in the later years, okay?
Correct.
And all of a sudden, it's not that you can't do it. Somebody asked me this a long time ago. I said, it's not that you can't do it. You get to that point, you just don't really want to do
Right.
it anymore. Now,
Right.
why don't you go work out every day? I really don't want to do that anymore. I did it for 55 years.
Exactly.
Why do I want to do
It's
it now?
time to rest.
But
Yeah.
without doing that, though, people don't understand what the effects that has on your body. So
Mm-hmm.
as you're mentioning, that change, sometimes we get a lot more sedentary.
Mm-hmm.
It's changing our diets, different things of that nature. But
Yep.
as sometimes you mentioned, just hereditary.
Hereditary.
And sometimes it may just happen.
Family
right?
history. If your parents have had polyps, colon cancer, diabetes,
Okay.
and unfortunately your race, African Americans have the highest incidence and mortality rates of all racial groups in the United States for colorectal cancer.
Okay, so how does it start? I mean, we're talking about having colorectal cancer. You don't know you have it. There's not a big warning sign, not a big red flag that shows up, and all of a sudden, you don't get a fever. You don't get this. How does it start, or is it? Well, you explain it.
Yeah.
You're the expert.
As we were talking about polyps,
Mm-hmm.
colorectal cancer starts as a growth on the
Okay.
inner lining of your colon
Okay.
or your rectum, which is called a polyp. And unfortunately, some of those polyps can turn into cancer. And the chance of a polyp changing into cancer depends on the type that it is. If you have a polyp and it's greater than a centimeter, if there's more than one, or if there's just an area of the polyp that looks suspicious, all those can be a risk factor for cancer.
Okay,
They
so-
need to be tested.
Okay, so, and a lot of times you hear people when they get a colonoscopy that they have polyps and they remove the polyps and they get them tested, right?
Mhm, correct.
Okay, so they're not called polyps when they take them out. They're called something else, aren't they? They call, I don't know, I can't. Anyway, I thought there was, maybe I've got that term wrong with something else, but polyps is what it is when they discover them,
and
right?
yes, and then when they take them off and get them tested, they may be called different
they call it
things.
something
Yeah.
different. Okay, all right. So, so we got the idea. We can get colon cancer a number of different ways. Could be hereditary, could be our diet, could be our lack of exercise, could be a disease.
Correct.
Something we can get. Hopefully, we don't eat such poor food that becomes the problem, but we do know that our diets have changed over the last 50, 60, 70 years.
Yep.
And so very, very good possibility that can. How about, you may not have information on this, Amy, I don't mean to set you up, so okay. But a lot of people take a lot of vitamins and over-the-counter medication. Could that have anything to do with it? Because, you can put a lot of these capsules and
additives.
Does that mess with the intestines a little bit?
I'm sure that it can. Most vitamins, they like to say, is good for you. Always talk to your doctor about it. There's could be side effects. Hopefully cancer is not one of them, but I'm a firm believer of everything you add to your diet. There's additives added to it, which could affect it, but
right.
Always important to talk to your doctor before starting any new medications or vitamins or anything.
Because those membranes and stuff, it's not like it used to be years ago. Either you poured it into a spoon and you had it, or it was a pill that dissolved in your mouth.
Right.
That was basically it.
Right.
Now you've got these time release with these membranes on there that allows your stomach acid to churn through, and then all of a sudden, there it goes.
Right.
And so, different things might happen, and that membrane has to pass somewhere. Doesn't just dissolve.
Correct.
It does dissolve, but it doesn't dissolve fully by the time it can go through your system. So there could be some things there. All right. So we have a number of ways it can start. How does it spread through your colon, or does it spread?
It can spread, unfortunately, yes. So the polyp, it can grow into the wall of your colon or rectum. Which can then spread to blood vessels, lymph vessels, can travel to lymph nodes, and then to other distant parts of the body. And the extent of that spread depends on how deeply that those polyps have grown into the wall of your colon or rectum.
Okay, because this happens because the nutrients that are taken out of your body's food and drink go through this wall, and they get absorbed into your bloodstream to give you the vitamins, essentials that you need.
Correct.
And it goes to your major organs, etc.
Correct.
It's all part of that. So if you have a polyp that's developing underneath that could release the same kind of toxins.
Correct.
I'm going to try and simplify this. Then that could spread in that way, correct?
Correct.
Am I hearing you correctly?
Correct. You could have a polyp that is just sitting there, not causing any harm. But if it's left alone and it is cancerous, over time it goes into that wall of that colon and can spread and get dangerous. So.
And that's why they're removed when usually, they find them in colonoscopies. They remove them fairly quickly.
Correct.
Unless there's something else they see there, obviously. And if they have to go do surgery, it's a different story. But if they can, they'll do it right there. Okay, so let's talk a little bit about colonoscopies, because I think this is where 99% of these are actually found by doing we'll say a regular scheduled colonoscopy. For some people, that might be 10 years.
Right.
For some, it might be 5.
Right.
And others might be 2.
Correct.
Okay?
Yep.
All right? So let's talk a little bit about this. So if you have a history in your family, you should probably get colonoscopies more often, correct?
Correct. American Cancer Society now recommends starting screenings at the age of 45.
Okay. Used to be 50, right?
Used to be 50.
Okay.
Yep. They've backed it back to about 45 now. So they can hopefully be found a little bit earlier, which is a great idea. I think the quicker
I'm
your
thinking
screens.
40. What harm is there to do it at 40?
Right.
But,
right.
But if you have something in your family, you may want to at 40.
Yes, you may. You have to see your primary care doctor. Let them know your concerns. If you're having any symptoms that need to be checked out, and then they'll get a hold of. For us at Salem, it's Dr. Voigt's office to get that set up. Make sure insurance is okay with it being done earlier.
Right.
Insurance always plays a part.
Or if they won't cover it and you will still pay for it, that's fine too.
Yep, absolutely.
So okay. So all right, so you have this, let's say 45, and you get your colonoscopy scheduled. You have to go through a routine to get your colonoscopy to clean out your obviously your bowels.
Correct.
Okay.
It has to be.
And it's not a
clean to
pleasant.
see. No, it's not. It's not. We always say when people arrive to the hospital, the worst part's over. You had your prep. You haven't eaten anything. The worst part's over. The day before.
Sometimes the air afterwards is a little embarrassing.
Yeah, sometimes a little bit. But it's, it takes a lot out of you. The prep does, but the results and getting tested is so important that it outweighs having to go through that prep the day before.
Yeah, very good. So depending upon your age and all these other factors we talked about,
right,
you definitely want to talk to your primary care physician and get that colonoscopy scheduled. When I hit 50, and I remember when I hit 50, I said, okay, let's get this thing done.
Right.
Let's not fool around with it. Let's get it scheduled, and I got mine scheduled. Now, I was told not to come back for 10 years. Well, now I'm past that.
Yeah.
Okay.
Time to come
so
back.
it's time to come back.
Yes.
All right. But a lot of times you forget about it. It's not something that's in the forefront of your mind like, I want to do a colonoscopy. It's just probably not, yay, the cheerleaders aren't out there to get the pom-poms. Let's go do it. It's not something, and it is a little bit time consuming because it takes basically 2 days, doesn't it? One day to cleanse your system, and then the next day to kind of recover.
Yes, and we at Salem do our colonoscopies on Mondays. Dr. Voigt comes the second and the fourth Mondays of the month. So you do your prep on Sunday, come in Monday morning, get it done, rest that day, the next day, and then you can go back to work.
So if they have to remove polyps, does that affect recovery time?
Usually not.
Okay.
Usually not. We always call and follow up the day after to make sure everybody's doing okay, and everybody typically does very well. Minimal pain. We always tell them to watch for certain things and call the doctor, but typically if they remove polyps, they're up and at it the next day. So.
All right, so let's go back to what I was talking about before. There really are no true signs of colon cancer. I mean, obvious signs right off the bat.
Right off the bat,
when
just
it's
by looking somebody.
When it's initiating, right?
But there are certain things to watch for, definitely.
Okay.
Bowel changes. If you notice you start having diarrhea, constipation, going back and forth between those things, feeling like you still need to have a bowel movement constantly and you just went. If you're having bright red rectal bleeding, or if your stools look really, really dark to you, your belly's hurting, you're cramping, you just feel tired, weight loss, all those things you need to bring up to your doctor. And I can't stress enough, just getting in to see your doctor, getting routine exams and physicals, because sometimes just blood work can show you some of the first signs. If your blood count is low, it could be a sign that you're losing blood slowly over time. You may not notice it in your stools. They may be a little bit darker, but it may be from blood loss over time due to cancer.
Okay, so health fair.
Yes.
Got another one coming in May.
Yes.
All right, so if you don't do that, this is a great way to get blood work at a super reduced price and get it done. So, yeah, if you need to go to your doctor and get it done, you can still do that, obviously,
Right.
but get
Come
your
to the
insurance
health
to pay
fair,
for it.
get your lab work.
But if you go to health fair, you can get that lipid profile. It's going to tell a lot for $35.
Right.
And yes, you'll have to fast before that happens, so it can be accurate. But the way I do it, and Amy, this is how I've been doing it for years, is I went back, actually, when I got my results this time, I went back, compared them to the last time I went, to the last time I went before that, to the time before that, and to see where that progression is. You'd be amazed. And what I started doing now is I actually wrote down the dinners that I had the 3 days before, because they affect what some of your numbers are.
You're very proactive in your health, and that's great.
Right.
That's fantastic.
And my numbers are borderline.
Yeah.
They're either at the very top end or bottom end.
Right.
Or they're, or they're just over. And then, of course, they get highlighted in dark numbers.
Right.
And they come to me, and then the doctor calls and says, I need to see you. And then I go in there, and we talk about the same thing we did the last time.
Yeah.
Not necessarily, but, we are just making sure that we're following up on those numbers. Why is that number high? Why is this number high? Why has that number gotten higher? Why has this number gotten lower?
Right.
There's got to be reasons. Well, one time I had a big Super Bowl meal before. You pigged out on all the wrong foods, and it takes a few days for that to get out of your system.
Right.
And you're carrying all that extra yuck food.
Yuck. Yeah.
Yeah, the salads are gone, and your veggies are gone, and your fruits are gone, but you're still carrying that around in your blood system. It takes a while for your blood to It absorbs everything that goes in your body. So if you put the bad stuff in, it takes the bad.
Right.
Put just the good stuff in, takes the good.
Yeah.
Okay? So, very good. So we've got real no telltale signs, obvious telltale signs, but there are some possible signs that could be.
Yeah, and I want to say the bad thing is that some of these signs can mimic tons of other things too.
Oh, right.
You know, you start having diarrhea, it could be from just a stomach bug, but it's important to just talk to your doctor, let them know what's going on.
Right. Don't
be
go
proactive in your own health care.
Don't go to
sure.
WebMD with a headache because you're going to have 5 tumors. And,
exactly.
Exactly. And you have no idea why.
Yep.
Or a backache. You think, I've got all these problems. My gosh.
Yes.
Or if your foot hurts, you may not have gout. You may, but you may not.
Right.
You might have kicked the bed, forgot you kicked the bed. I mean, there's crazy things that happen that we don't, but there are reasons. So one of the things is keep an eye on your normal functions of your body.
Yes.
If that starts to change, usually there's a reason why that's changing.
Yep. You're absolutely correct.
Right. So now if you don't eat a lot of fruits and vegetables and all of a sudden you change your diet, that's going to change your bowel movements too, right?
Yep. Absolutely.
So it'll be a different type of movement. It may be more fluid. It could be, not as hard to go. And so there may be some positives there. All right. So we all know colon cancer can kill.
It's the leading cause of cancer deaths in the United States, colorectal cancer. That's scary. But those numbers have gone down over time from screenings, from people getting out and getting screened. Personal story, I had a family member very close to me put the colonoscopy off for longer than he should have. Lots and lots and lots of polyps, but fortunately all of them came back okay.
Wow.
But he was told by Dr. Voigt, you are smart that you came in, you give this another year or two, and those polyps could have been deadly. So get screened.
But 3 years earlier, it would have been easier.
Yes.
And
he
then
may not have had so many
Right,
polyps.
and then you already have that issue that you need to kind of keep an eye on. So very good. Okay, so we kind of talked about this, 45 and above, okay, and...
Or if you're having symptoms, any symptoms.
Right, but even if you have some symptoms, you probably want to go to your primary care doctor first, right? And then just address those with them, and they can, they might want to do some blood work, or they want to do something and check that out. But you definitely want to make sure that you start putting this on the calendar, right?
Yeah.
When you hit 45, between 45 and 50, you definitely want to make sure you get that first one. And then after that, if they tell you to come back in 5 years, if they find a polyp, they're probably going to tell you to come back sooner.
Correct. Sometimes 2 years.
Sometimes 2 years.
Yep, 2 to 5. If nothing's found, 10. Unless you start having abnormal symptoms, you need to go in and talk to your doctor about that again.
And sometimes during colonoscopies, they do find other things. There could be other problems.
There could be other problems. Yep.
Yeah, that they can actually see that they could not have seen before.
Right.
Okay, so very good. So, we have a number of things we need to do with our colonoscopies. Number one, have them done. Have them done when they're recommended to be done, and don't put them off.
Right.
Okay. Second thing is that you can have them done right here in Salem.
Right here, close to home, 2 times a month. Let your primary care
Well, you
put
don't
a consult.
You don't want to have that 2 times a month.
No, I don't.
I don't think anybody does. But they're offered twice a month. There we go.
Yes. Okay. Have your primary care physician put in a consult. Dr. Voigt has a clinic here at the Salem office as well, twice a month, the second and the fourth Mondays. They'll get you in, they'll see you, and then we'll get you scheduled for the colonoscopy. And we will call you from the hospital a week before you're scheduled and get your pre-op interview and talk to you a little bit beforehand.
They don't take very long, do they?
No.
No.
The procedures themselves, on average, 15 minutes, I would say.
And you're not awake to see it.
Nope. You're sleepy. Our anesthesia providers make you very comfortable. Everybody is typically afraid of being exposed, and we don't do that. You're completely covered during this procedure. As soon as the doctor comes in, he does what he has to do, but you are not exposed. You're you're warm and sleepy, and
Right.
we'll make
Yeah.
you as comfortable as you can.
I will say that is the case. Of course, you know, knowing a lot of people at the hospital, they'll also razz you, you know, and have
Yep.
some fun with, you know, and they want to put you at ease. That's
Yes.
the whole idea. They're
Yep.
not trying to scare you, but
No.
they want to put you at ease. And you're going through something that, as you mentioned, a lot of people find embarrassing, you know, but there's nobody in there but the doctor and the nurses to take care of it. And it is a vital piece of your health that you need to not ignore. One of the things that has come up with insurance lately is most insurances will cover this as preventive, right?
Correct. Screening colonoscopies most of the time are covered, but you always need to call your insurance company and ask just to check if there's any special fees that may come up depending on what is found during the colonoscopy, if they have to remove a polyp, if they're going to have to pay anything out of pocket for that. But most insurance companies are now trying to cover the cost of screening tests, but
Yeah.
always call and check.
Yeah, don't surprise your insurance company by
Right.
going and doing it first and saying, by the way,
Right, surprise.
I did this, and here's the bill.
Yes.
And they're like, that ain't going to happen.
Right.
No, contact, usually when your primary care physician, you talk to them about that, they can actually then indicate and contact the insurance companies to get this done for you.
Yep.
So, you know, please go to them first and talk to them and get this thing set up. And then they will actually schedule you a time with Dr. Voigt, right?
Correct. Yep.
Okay, very good.
Yep.
None of that has changed then. So
No.
that all part is still the same.
Yep.
And then you'll get scheduled for your colonoscopy
Yep,
time.
Dr. Voigt's office will contact us and let us know that you are on the schedule, and then we will get a hold of you.
Okay, and then you will come in, and again, you'll go through the pre-day or
Yes.
pre-testing fun.
Yes, which it starts about 1 o'clock in the afternoon. You start drinking the prep. You do clear liquids only, Jello, broth, that kind of thing. Avoid red dyes so nothing looks like blood when we're in there. And then after midnight, nothing to eat or drink after midnight. And then you'll come in to see us, and we'll get the ball rolling. We'll ask you questions, sign paperwork. You may have some lab work the morning of the procedure. You'll talk to Dr. Voigt and to our anesthesia providers, and we'll get the test done and get you home. Usually you can go home about 20 minutes after the procedure.
Yeah.
As soon as you're awake enough, we'll let you eat and drink, and you can go home.
But have somebody there to drive you home.
Exactly.
Yeah, don't
Yep.
try and do that. You are under anesthesia, so you don't need to be out there driving
Nope.
at all.
Yep.
And there are some, I'll say, after effects that may may happen to you.
Yes.
It doesn't happen to everybody, but it
Right.
does happen to some.
Right.
About how many colonoscopies can you do on each of those days?
On average, we do about 10 a day.
10 a day.
Yeah, we
Well,
can.
much.
We do as many as they schedule for us.
That's pretty quick.
Yep.
Get them in, get them out.
Yep.
And of course, you have to move one in, move one
Move
out.
one out, yep.
Prep it, take a look, get them
Yep.
anesthetized, and then they can
Yep.
do the thing. Very good. Somebody has any questions about colonoscopies or colon cancer, can they contact you, Amy, or Cindy?
Absolutely. Yeah, absolutely. Just
Okay,
call
what's
out to
your
the
number, hon?
Salem Hospital. It's 729-6626, and you can ask for the outpatient surgery department. And we'd be happy to answer any questions for you.
Okay, or guide you in the right direction of how to
Absolutely.
get this done. And
Yep.
of course, if you have a primary care physician, you can also call them and talk to
Mm-hmm.
them about, is it time for me to get this, or do I need to get another one? You know, if you haven't had one in 8 to 10 years, I highly recommend it.
Yep.
I know, and I'm going to be getting one here pretty soon, so
Yep.
I know it has to be done.
Has to be done, and
you
it's quick and
don't
easy.
say you don't have the time, because you have to make the time.
Right. Have to make the time for your health. It can be scary
Can be
very
scary.
quickly, so don't
Well,
put it off. Come see us.
There you go. Amy,
Yeah.
thank you very much for
You're
your time
welcome.
and
Thank you
coming
for
in.
having
Amy
me.
Thompson from our Salem Memorial District Hospital, our spotlight on the hospital and dealing with colon cancer. And we thank you again for stopping in. Sorry you didn't have Cindy with you
Yes.
to assist you on the side, but you did a great job.
Thank you. Thanks for having me.